Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, I have a mentor, a mother, a consultant, someone who has ticked all the boxes for me. Please join me to welcome Dr. Adaeze Oreh.
Thank you so much for having me on your wonderful platform. I'm so proud of you. Thank you for inviting me.
Thank you so much, Dr. Oreh. How are you doing today?
I'm great. I'm doing well. Happy to be here.
Okay. I have an expert here. Whenever she's around, I don't talk too much. Let me quickly read her bio. Dr. Adaeze Chidinma Oreh is a Nigerian family physician, public health expert, and advocate for universal health care. She currently serves as Commissioner for Health in Rivers State, a 2019 Aspen Institute New Voices Fellow. She previously led the Abuja Centre of the National Blood Transfusion Service, 2009 to 2014, where she helped revise Nigeria's national blood policy under the National Health Act of 2014. Dr. Oreh earned her MBBS from the University of Nigeria and holds postgraduate degrees in international health management from Imperial College London and public health from the London School of Hygiene and Tropical Medicine. She is a fellow of the West African College of Physicians and is certified in health leadership and quality health care by Harvard, the University of Washington, and the University of Bath. I hope I got your bio right. I got it. If I made some mistakes at all, I did ask is it the Amuje? I don't know how to pronounce it.
Amuje, you actually got it right. You see, an African woman, it's just there in your DNA to know how to pronounce Amuje.
The Amuje Fellowship. Thank you so much for being on this platform, Dr. Oreh. It's an honor to have you on board. My experience with blood donation. Today we're talking about blood donation in Nigeria on your paper on serovirulence, which is associated with blood donation in Nigeria. And since you're a top voice in blood donation in Nigeria, it's expected for you to be the one to bring on board. My experience on blood donation in Nigeria started not, I knew you, we knew each other, but what I knew with regards to working with you was public health. Actually, I should let the world know she's the one who brought me to the field of public health through the West African Institute of Public Health by advising me to apply to be an intern at the West African Institute of Public Health. So the relationship between us has been mentor-mentee and around public health. But when I joined Gender Development Initiative as a blood donation advocate, where I earned the best health advocate, was where I saw firsthand, even though I did it virtually, was where I saw firsthand the knowledge, awareness of Nigerians, their perception, even their attitude towards blood donation. I was like, yeah, the government is doing a lot of work. People like you are doing a lot of work, but still, there is still a lot of work left to be done with regards to blood donation in Nigeria. So, Dr. Oreh, our honorable doctor consultant, with regards to the paper, what were you trying to tell us about serovirulence?
First of all,
Seroprevalence, I mean.
Yes, that's fine. First of all, my career journey within the blood services, as you rightly said, started with coordinating the Blood Service Center in Abuja and also affiliated with Niger State and Nasarawa State that didn't have their own blood centers at the time. So working very closely with the zonal blood transfusion service in Plateau State, which covers North Central. And of course, being in there within the blood service, we had access to the data. So the way the blood service was structured is you have donors, intending donors who would come into the centers, they want to donate blood. And because the national blood policy was trying to encourage voluntary blood donations, we would collect the blood from those intending donors, of course, counseling them that this blood we're collecting from you will not be transfused until it has been screened and deemed fit to be given to a patient who requires blood transfusion. And then at that point of pre-donation counseling, we'll then, of course, in discussions with the intending donor, say, now this screening are for this infection. We'll be checking for HIV 1 and 2, we'll be checking for hepatitis B, hepatitis C, and syphilis. If the result is out, do you want to know what the result is? Because this is part of, getting informed consent from the donor. And also counseling them on the importance of knowing their status. So it was double-pronged. It was raising awareness about the importance of blood donation, but at the same time, sensitizing the public through these intending blood donors about the importance of knowing their status for these very important transfusion transmissible infections. And the reason is that when the results would come out, they could then be guided. If it's negative, you encourage them, continue living a safe lifestyle. If it's positive, tell them, obviously, your blood cannot be transfused, but these are the steps that can be taken. And so from the back end, we were seeing very alarming prevalence reactivity. So from the lab screening, the results would come out, and obviously, because of the amount of work that goes into sensitizing the public, getting to convince people in our kind of Nigerian and African setting about donating blood, it's painful when a lot of that blood cannot be used for the purpose that it was intended, because there's a reactivity for any one of these infections. And so we felt the need to actually study the trend of this seroprevalence over a period of time, so that the information wouldn't just be for us within the blood service, but also serve to educate the public, share and disseminate this information with other stakeholders in public health, so that we could take necessary steps towards addressing this. Of course, the most alarming was hepatitis B, which has not enjoyed as much attention as HIV over the years for various reasons. I mean, the more development partners and organizations that are interested in a particular sector or infection, as this case may be, obviously the more attention that it would garner. And so we felt that this was something that we owed the country to actually rigorously study this and present our findings to the public, so that collaboratively, cohesively, we could do something to address this growing problem in the high seroprevalence rates for infections such as hepatitis B.
Thank you so much, Dr. Oreh. You were the head of National Blood Transfusion Commission. Do you feel Nigerians are receiving enough education and advocacy on blood transfusion and its benefits to us as a nation from government, non-governmental organizations, and private institutions?
Well, first of all, I know, Dr. Aziz, that you're quite biased. I was not the head of the National Blood Transfusion Commission.
I thought you were the head of research.
Yes, I was the head of research, but when you stated it, you didn't mention the research. So I was heading research, yes.
Okay.
Yes. So I said, there you go. I've got my girl. So yes, there is a challenge around the necessary support and resources that the blood service needs to, first of all, grow the blood donor base, because it requires, I mean, Nigeria is, a lot of our sister African countries say Nigeria is like multiple African countries in one. A population of over 220 million. Imagine sensitizing that number It's not something you just pick up a microphone, stay in your office, and the entire population is sensitized. You have to, of course, with a community-oriented view, reach different communities, speak to them in the languages and with their cultural context in mind. That isn't an inexpensive venture. It requires substantial resources to get the individuals who will be doing that sensitization trained, get them transported, develop even the material, engage the media and even local information dissemination tools. So all these things cost money. And unfortunately, it's not something that has garnered sufficient resources over the years. Not to say that if you had an inexhaustible source of funds, because there are other issues to contend with, like the cultural biases, which we'll speak to later, but at least so that we have a fighting chance towards building our blood donor base. At the National Blood Service, while I was there, one thing that was always said was any individual, the safest blood transfusion is the one that's not given. But that's not to say that there will not be people who will require blood transfusion. We know our statistics: road traffic accidents, pregnancy and childbirth, cancers, renal conditions, surgical procedures. Of course, that hasn't even got me into sickle cell disease, malaria, severe malaria with severe anemia. All these would require blood transfusion. So whether we like it or not, it is still a mainstay of medical therapeutics and interventions in medicine and surgery. So as part of trying to safeguard the lives of people who would need blood transfusion, we need to have sufficient blood units in stock, not just within the blood service, but also within hospitals that would be serving as transfusion establishments. A lot of the things that erode trust when we're trying to engage with blood donors is, oh, I donate this blood for free, but when I or a loved one has a need for blood, they are required to pay. Now, so those are some of the challenges, because the service is, or the agency is, with a lot of progress so far, but still a largely unfunded part of the public health system. There's so many resources that need to go into that. So it's not that the payment is to pay for the blood in itself, because you can't even quantify what the value of that blood is, but the processing, the screening, the reagents, the storage, especially in an environment where we know what power generation is like. So it's even much, much worse than when I was there at the blood service, because of the escalating prices of, generating power now. So that storage, even the training for the professionals who would be screening, who would be carrying out the processing, all those things cost enormous resources. And if we want to ensure that it is safe blood that is available for transfusion, those things are not nice to have. They must be had. They are necessities within the blood processing system. And so I would say that there's still room for further advocacy, for further attention and support for the work that is being done at the National Blood Service Agency.
Thank you so much, Dr. Oreh, for shedding more light on that. We'd like to know, for each TTI, female donors had higher frequencies than males from the paper. Why do we have such deviation in statistics?
Well, so first of all, if you look at the general statistics, for example, we still have the National HIV/AIDS impact survey, household survey that was done several years ago, and other prevalence studies that have been done. There is a higher risk for women to be infected with infections such as HIV. It actually tallies with the science. they are often more vulnerable to infections. And so it was not surprising. But however, from our research, what was saddening about it was the fact that there was such a tiny proportion. They were less than 3% of the donor base in our study. And still, there was a significantly higher risk of being seropositive for any one of those infections. So what that tells us is we still have a lot of work to do in the general population with regards to sensitizing against some of these infections. We need to be targeting female populations, certain demographic groups with the sensitization information. It shouldn't be a one size fits all, because a lot of times when it's a one size fits all, many of these very vital demographic subsets will be left out of the conversation. That sensitization may not be as relevant as when it is tailored to them and designed to pass that message strongly to them. So imagine a sensitization campaign that is deliberately targeted at women, not just the general population. So it will capture women's specific needs, women's specific risks, which the receiving women, the women who are being sensitized, will identify with. And it can resonate and translate effectively into lifestyle changes that can safeguard their health and protect them from these infections. So that female preponderance is not contrary to the expectation of the science. It was just particularly staggering that even in such a tiny group, amongst all the 98,000 plus blood donors, even the fact that less than 3% who happened to be female still had a significant substantial risk of being seropositive for those TTIs.
Thank you so much, Dr. Oreh, for shedding more light on that. I understand we have more work to do on women's health and generally the female population. And with people like you, excellent people like you, with great doctors like you, mentoring great women like me, I'm optimistic we'll have better statistics in the next decade and in the next century. And that question for you, Dr. Oreh. I worked for JDI, you know of it, and while I worked for JDI, I was opportuned to utilize the opportuned to utilize artificial intelligence to make blood donation faster, easier, safer for Nigerians. I would like to know, the National Blood Transfusion Commission, to the best of my knowledge, they've collaborated with JDI on some occasions. What measures are the Ministry of Health taking on artificial intelligence for blood donation?
So when you say Ministry of Health, which Ministry of Health are you referring to? Federal Ministry of Health, National Blood Service Agency, or River State Ministry of Health? Because we have to be clear, especially with institutions like this, that their voice is by a recognized spokesperson of the institution.
Which one do you prefer to speak on?
Basically, obviously you've mentioned partnerships between the National Blood Service Agency and organizations such as Gender Development Initiative. That is because the agency recognizes that obviously there's a need for public-private partnerships to scale a lot of the technological innovations that can help. So I won't be speaking on the MBSA because I'm not the representative. There's a director general and there's a management team in place, and I'm sure they're best positioned to mention this. But I will speak as a public health and a public sector leader who is interested in technology as a means towards scaling and addressing some of our public health challenges. So in River State, there was something that we leveraged artificial intelligence for the diagnosis of mpox. And one of the benefits of artificial intelligence, I know it gets a very negative rap every now and then, is that it's exponentially harnesses big data. And the speed with which it does that is beyond what, humans can do, because you are trying to pull significant amounts of data in the shortest possible time. For you to get humans to do that, it would be so expensive and such a laborious endeavor that I think if there's technology available to enable us achieve that in the shortest possible time, then it's something that we should look towards leveraging, and leveraging ethically to get the benefits while not jeopardizing the safety of those whose data is being used. And so for us, what artificial intelligence helped us do with regards to Mpox was to pull multiple images of confirmed cases of Mpox and these were then harnessed into a mobile app that could be used in even the most remote locations. So you wouldn't have medical professionals who are in rural and often riverine and remote communities waiting for somebody with the necessary expertise to get in touch with them and confirm whether it was a likely case of Mpox. So with that AI-driven tool at the tip of their fingers, they could form a concrete suspicion of Mpox, of course, waiting for laboratory diagnosis. So that just minimized the time of infectious disease surveillance and notification with regards to Mpox. So now that's a clear example of where AI can be leveraged by challenges that we face. In terms of blood services, there's a paper that I worked on with other colleagues from the International Society of Blood Transfusion. And during the COVID-19 pandemic, we wanted to see which of the blood services in various countries utilized artificial intelligence through predictive modeling to get voluntary blood donors in to donate blood during the pandemic and during those times when there were restricted movements and lockdowns across the world. And so that information too was helpful because it showed that there are blood services that are looking towards the future to see how we can leverage technology to tackle what is a general challenge. How do we convince people to come in and donate blood regularly? And so from those examples and the data which has been shared, I will share it with you later if you haven't had the chance to read it. That will also serve to motivate other blood services that haven't actually leveraged on this, because now the first example of AI I used was for infectious disease identification. Now we're talking about forecasting, we're talking about planning, we're talking about using technology to see who are those donors who are likely to turn up. When you identify such donors, then you can carry out initiatives that will enhance their likelihood of showing up, and using certain markers from identifying them to target other people who may not be those regular donors, but who you can actually convert to coming into blood services more regularly and more frequently. And so there are lots of opportunities in the technological space, but obviously it will require partnerships. It will also require those who are coming up and thinking through problem solving from a technological lens to also reach out to agencies that are doing significant work, like the National Blood Service Agency are doing, so that they can put some of these ideas towards them and see how they can collaborate. Of course, also with various state ministries as well, so that we can collaboratively tackle some of these challenges and raise blood donor base within the country.
Thank you so much, Dr. Oreh, for that. Thank you for sharing your perspective as a public health expert with regards to that question. According to the National Blood Service Commission, Nigeria gets only 27% of its annual blood need from voluntary blood donors, leaving a shortfall of about 73.3% of blood need every year. Please, can you give us 3 myths and facts about blood donation in Nigeria?
The top of my head, first of all, there's this myth, the source I have no idea, that blood donation will render someone to have mental health challenges. So maybe it can bring about schizophrenia, it can bring about bipolar disorder, depression, whatever it is, simply from blood donation. The second is that it renders people infertile. And the third is that just the process of donating makes the donor get infected with HIV, say HIV. So sometimes you wonder what is the thought process that brought about this myth? But they are so ingrained in a lot of communities. In fact, let me even share a fourth, that blood donation makes people steal. You just be wondering, like, how, And so when I talk about sensitizing communities, it's not just about going and telling them, it's about engaging with them, finding out what their perspectives are really around blood donation, and then working with them, with people who can actually influence such communities, from within the communities, from outside the communities, showing them lived examples of people who regularly donate blood and do not have mental health challenges, have children, and are not stealing, and haven't contracted one infection or the other from the process of blood donation. So it's a very complex area because it has to do with human understanding and human behavior, and it will require translating into significant positive behavioral change. So it's not just a purely scientific endeavor. It also requires sociological interaction, anthropology, studying cultures and engaging with cultures appropriately. But all that requires robust partnerships, significant resources, and political will to drive it.
Thank you so much, Dr. Oreh, for sharing that. Actually, why I asked in Nigeria, because Nigeria has a culture of its own. Every country has a culture of its own. And that's why we keep talking about this myth and trying to demystify what is happening in our societies. And with platforms like this, and I believe it's more advocacy and education awareness in our communities, we can help tell people about the fact about blood donation and why they should stop getting scared about blood donation and any complication that can come from it. Dr. Oreh, please share your most touching blood donation story you've experienced and how it has shaped your work as a top blood donation voice.
There's so many touching blood donation stories that I've been privy to, but the one I want to share is actually linked with myth, and so that's why I want to share it, because I've witnessed blood donations from people who lost their loved ones either in a road traffic accident or during the process of childbirth or even during pregnancy, where family dynamics were completely upended and turned around from the loss of that person in their family. And so they've committed to donating blood. But for me, one stark example that keeps showing up, and I've shared this on several platforms, was a young man. He was on his lunch break from the office, and he decided to come into the blood center. So I wasn't the phlebotomist. I was heading the blood center, so I was in the office. And I got a call that my attention was needed in the bleeding section, in the phlebotomy section. And so I came down. And there he was in his shirt and tie. He had taken off his jacket. His sleeves were rolled up. He seemed pretty excited, about donating blood. But apparently, in that excitement, he had called his mom to say, Mama, I'm here. I'm going to donate blood. And she demanded that he get off that couch and he not donate blood. And so he was distressed. Before somebody commits, I'm going to donate blood, there's a thought process, not just something you just
Exactly.
walk off the street and do. So he
Exactly.
was quite distressed because he had taken this decision and he loves his mom. And here she is telling him, get down from that couch. And then to surprise you, the reason he was particularly distressed was his mom was a senior nurse. She was a
Wow.
senior nurse in one of the establishments outside of town, but she was a senior nurse. So she was, in his view, a respected health professional. And here she is telling him, my son, get down from that couch.
Wow.
And so they called my attention because he said, please, who is in charge of the center? I need you to talk to my mom. And so I said, no problem. Place the call to her. He placed the call and handed me the phone. And I spoke to her and I said, Matron, what's happening? He said, that her son is yet to get married. Coming back to the myth, her son is yet to get married and now he wants to donate blood. What would that do? That means by the time he gets married, he won't have children. And I said, Matron, but these are some of those false beliefs. And I spent the next almost 30 minutes counseling this lady. Of course, I took up the call and we now called her back with our own organization phone. By the time I finished talking with her, she said, thank you so much, doctor. She never looked at it that way. She was just looking. So you see that sometimes the challenge is when we think about the Me Too, think about maybe somebody in the village who hasn't stepped foot out of the village and, those are just the cultural myths that have perpetuated. Sometimes these myths are being driven by professionals like ourselves. And you see why the challenge of sensitization is so immense, because it cuts across demographics, the socioeconomic ladder. It cuts across everywhere. People who you think are educated and should be more aware sometimes are the people driving these myths. And so by the time we finished speaking, he got back on the couch. She spoke to him. She said, oh, no, okay, no problem. This. He got back on the couch and he donated. But just imagine if there wasn't time for me to engage with her. So he
Exactly.
would have left the center because he has got that information from his mom and maybe tell his co-workers, you donate blood, sorry if you never born, So
No child for you.
no child for you, So these are the challenges that staff within the National Blood Service Agency face on a day-to-day basis. And sometimes these myths are driven by the least expected people, and you just have to be ready to counter them. And that's why there's a need for significant partnerships and resources to help support that sensitization work.
Thank you so much, Dr. Oreh, for sharing that story. It was actually, I'm shocked. It's my first time I'm knowing that a health professional will believe in such myths. And you can imagine if a health professional believes in such myths, you can imagine what the ordinary Nigerian, the false narratives going on in our societies. So, Dr. Oreh, as a leader at country level, how are patients who get infected from transfusion managed short and long term?
Okay, so the ideal model is the model that is imbibed within the national blood policy, which is that by the time somebody is confirmed seropositive, they are linked to care. So that's the ideal. And that is what the National Blood Service Agency is part of their mandates in the technical supports that they give to other establishments that may be recruiting donors, blood donors and all. But a lot of times this doesn't happen. And this was also highlighted in the paper, that there is room for significant improvement in the linkage to care. So from the blood service angle, I believe, which was in effect until I left, and I believe that according to their mandates, this is still continuing. But in many other establishments that are taking blood donations and screening, sometimes because of maybe the volume of work, because they are not purely blood service establishments, they have so many responsibilities, that linkage to care can often be suboptimal. And so that's why there's a need for it to be a concrete policy that once anyone screens seropositive and is confirmed, therefore requiring treatment, there needs to be a two-way conversation. So between where the individual was screened seropositive and where they should be receiving treatment, there has to be that direct communication and feedback after the individual must have gone. But what we often leave out in this conversation is who bears the brunt of that care. So we've already spoken about how challenging the resource environment is for blood service establishments. So what does that mean? That maybe that care will have to be borne by the patient or by that donor who's been sent. So you can see that sometimes the individual may be linked to care, but at the caregiving establishment, once the price or the cost of that care is communicated, the person say, I was not sick, I just blood I want to donate. So I don't have this money now. I will just go back into society. So these are some of the things that we need to be looking at. There's this from the study we've done, and obviously from other research that scientists have done over time. There's a significant group of the general population who are infected, who will be touched at one point or the other to go and donate blood. And in the event that they turn out seropositive and are confirmed and require treatment, what plans are in place for the management of such individuals to reduce, to treat them, perhaps eradicate the infection, render them safe for themselves, their families, the society, and also render blood transfusion safe. But who bears that cost? And that's one of the things that we need to think about.
Thank you, Dr. Oreh, for elaborating on the effective management of those who are positive. I would like to know, blood donation is still very low in the country, despite commercial blood donation being in use. As a top voice, do you feel if more and higher incentives are given, the country's blood donation strike will be solved?
Well, the
Because
thing with incentives,
yes, because the economy now in Nigeria, if you say you want to give money, people will definitely come and say they want to donate. So do you feel we can solve the blood donation?
So that's the thing. If you look at it from the perspective of the incentives being given by the National Blood Service Agency alone, as somebody who has been there in the past and somebody who is deeply committed to safe blood donation and having available stocks of blood for the population, I would say it's unsustainable. That's the truth. The Blood Service Agency cannot afford to have an inexhaustible source of incentives. But it brings me again to partnerships. And I think there is significant room for our organized private sector to think through systematically transforming the way they do corporate social responsibility. So if you look at various other countries, a lot of the blood services are driven by private sector donations and all that. You even mentioned in reading my bio, you mentioned that I have some postgraduate qualifications from Harvard. Harvard, in recent times, has had a significant defunding from government. But have you heard that Harvard has closed?
Mm-hmm.
Harvard is still up and running. because of significant private sector investment and commitment through donations and through grants. So I think that for Nigeria, we put so much pressure on the government. And I mean, I've been at the federal government level and now at the subnational. So from those two perspectives I have seen, government cannot do everything. There's a need for partnerships. And I think we have to restructure the conversation so that even the organized private sector know that, because they also seek to make impact through their CSR, through their corporate social responsibility. So if they are given to understanding that there's room for significant impact through a systematic approach to that CSR, and not just, one-off donations here and there, bags of rice, cartons of Indomie, and, it will transform the way a lot of our systems work. And I think that it also adds another layer of accountability, because that private sector fund doesn't just come like that. You have to show how it is used, how it is translated, and the output from that. So I think that such collaborative initiatives between the public and private sector can actually strengthen both, gives more impact to the corporate social responsibility of private sector. They can see more impact. They can see the transgenerational translation of their philanthropic endeavors. And at the same time, it will help to strengthen accountability for whatever output is being required of the public sector. Call me optimistic, but I think that is something that we should be looking towards.
Thank you so much for shedding more light on that, Dr. Oreh. We need more collaboration. No sector can do it alone, and that's why I have the mantra, each one help one. We can help each other to achieve our aim as a nation. Dr. Oreh, science keeps evolving on blood products being made in the lab artificially. What is your say on this?
Science is dynamic. That we should always keep pushing the button and seeing what we can achieve with science. So I'm always one for innovation and development. But at the same time, even with the steps that have been taken so far, blood doesn't have a substitute as at now. And so whatever we can do to safeguard the blood we have available and make sure that at any point where someone needs a blood transfusion to save their lives, the safest possible blood is available to do that. I think, so while we're also venturing into innovation and development and seeing what strides we can achieve with regards to substitution, the reality is there isn't a substitute for blood right now. And so let's do what we can to safeguard our blood spaces.
Thank you so much, Dr. Oreh, for that. And that question for you, highest frequencies of TTIs were observed in paid donors, 26.5% in the paper, compared to 14.5% in voluntary donors, 6.6% in replacement donors. Is there any relationship between those who were paid and TTIs, or it's just a coincidence?
It's not a coincidence. It's not a coincidence. Someone who's paid simply wants to be paid for his blood. He's not promising you a safe lifestyle to guarantee that blood. So by virtue of the thought process that goes into pay me for that blood, unfortunately, for a lot of paid blood donors, that payment will go into various vices, which often perpetuate unsafe lifestyles. And so it's not a coincidence. And that is why, if you look at the National Blood Service, the Act, there is punishment for commercialization of blood donation. Although the enforcement, we know, might not be widely enforced across the country, but it's a crime. And that is because research work has shown all over the world, when people demand payment for blood donation, oftentimes there's no guarantee of the safety of that blood. But because of the desperation that often goes into seeking blood, families, patients will go and pay these individuals. But it's unsurprising that they had such almost double the TTI rates, seroprevalence rates in paid donors than in voluntary donors. And then see the replacement donors. Replacement donors, there's also a lot of potential for replacement donors becoming voluntary donors. You can see the safety profile. They were even less than voluntary donors. What that tells you is that oftentimes we, the relatives, we, the families, we, the patients, do the process of risk selection of, you might have 10 neighbors, you know the one you're going to call to ask to donate blood. So you've already done some risk stratification by yourself. So replacement donors are often not random. They are often carefully selected. You have 10 cousins, you need blood, you know all of them are matches for your blood. You know the one you're going to call. You know the one you're not even going to call, and you're going to tell the other, don't even call that one, no. And you know why. Because we are human, we know our people. We know
Yes.
those who we feel are risky. We know those who we feel are safer and more responsible. And so that is why there's prime opportunity to convert those replacement donors to voluntary donors, because there are already people who are leading somewhat safe lifestyles, known to their families, known to their communities. So imagine having more of them in the blood donation pool. It therefore translates to safer blood within the blood donation.
Thank you so much for elaborating on that, Dr. Oreh. Personally, I feel Nigeria, I don't know if I'm right, Nigeria has the highest number of non-governmental organizations in the world. I don't know if I'm right, because NGOs
Probably.
keep growing every day. Please give 3 recommendations or advice to any Nigerian starting an NGO to improve blood donation in the country.
First of all, I will commend them, because this is a very challenging area in which to work. But my advice would be to seek collaboration. Don't seek to develop a parallel system. So work within the existing framework of the National Blood Policy and the laws that are regulating the National Blood Service. Engage with the blood service and clearly identify where you want to work. So for JDI, they have determined that their own segment is on sensitization, raising awareness and recruiting more blood donors, and then linking to facilities. The problem with a lot of NGOs is that they want to do everything. You cannot be a parallel blood service. The country has a systematic framework. So find where you will place yourself within that framework so that you're a valuable partner to the entity like the National Blood Service. That way you will see more growth than if you want to do everything and you want to run a parallel system. And oftentimes for those organizations that have tried that route, I've seen them fail and just, die off. And it's basically because there's already a system. Find how to partner effectively with that system. See where you can support that value chain and stay there so that your consistency will translate to positive outcomes.
Thank you so much for that beautiful answer, Dr. Oreh. Let's quickly look at some tweets on blood donation in Nigeria from Abuja Taylor. Abuja Taylor said, I don't know the country you are in, but in this Nigeria, I have bought blood in hospitals and also paid for screening. Even in National Blood Transfusion Service Center, which is Zone 3, I bought blood there in 2022, went back to hospital and paid for the screening. It's not free. Then the second by Sahara reporters. My son will live with HIV forever. Distraught father says as military hospital confirms toddler's HIV diagnosis after blood transfusion at Edo Clinic. I'm actually surprised because I believe military hospitals have the best screening services. They have the best, to the best of my knowledge. I feel they have the best
No, the military
services.
hospital. No, the military hospital, from what you read, is where the son was screened and found to be positive. It wasn't where he was transfused. The
Oh,
transfusion
okay.
happened in the clinic you referred to, at least from
Exactly,
my
exactly.
understanding of what you've just read. Yeah.
Exactly, exactly, exactly. That's what happened. So another tweet is by Shell Nigeria. To give blood, give hope. Together we save the lives. World Health Organization. I feel Shell had a blood donation drive. This year, Shell
Mhm.
Nigeria joins the League of Voluntary Blood Donors as Shell Health, in conjunction with Lagos State Blood Transfusion Service, commemorates this year World Blood Donor Day. It's great to
Blood
see
donor
the
day.
collaboration you were talking about
Yeah.
earlier. So
Yeah.
to conclude this, Dr. Oreh, global citizens, I want us to know that blood donation is good for our health. That's why we are having more advocacy, more education, more investment, and we're asking for more collaboration in the on the aspect of blood donation in Nigeria. So why should you, what are the benefits of blood donation to you as a global citizen? Before donating, a physical examination is done at no cost, which can help detect any abnormalities in pulse, blood pressure, temperature, because average Nigerian and average individual, we're just about to also really check our vitals. And that benefit to you as a global citizen is it improves the mental health of the donor if you donate blood, because it's a humanitarian strive. Also, it maintains blood homeostasis. Homeostasis is balancing all the systems in the body and how it works because of the new blood cells which replaces the blood donated. Another benefit is diagnosis of diseases such as hepatitis B and C, HIV, if the donor has it, thereby improving their prognosis. Another benefit is reduction in iron absorption by the body, which might induce heart, liver, pancreatic diseases due to iron overload. And lastly, it lowers body weight, which in turn reduces the BMI. You that you are like fit farm, one of the things you can do is blood donation. Check if you're eligible for blood donation. So thank you so much for honoring our invite, Dr. Oreh. Please, you have a closing statement for global citizens on blood donation.
Yes. First of all, blood donation, safe blood saves lives. I'll start with that. And my closing remarks, I want to also speak to one of the tweets, the very first one where the individual said he blood is not free. Of course, at no point in this conversation did we say blood is free. But the truth of the matter is that the system greatly subsidizes that blood. But the more effective collaborations, and I'm just speaking as a blood advocate, the National Blood Service Agency, of course, can speak more to this, but the more robust collaborations that are had will drive down the cost to the end user. And so if you have collaborations where reagents and supplies systematically and regularly donated or sent to the blood service, that drives down the cost. Partnerships around renewable energy and provision of energy to adequately keep the stored blood viable, all these drive down the costs. Now, there was a point when I was at the blood service, the cost of producing 1 unit of blood was over 100,000. 100,000 naira. When you think of the staffing, you think of the training, you think of the power generation, the reagents, the blood bag itself, maintaining the environment, even for the blood donor. And then at that point, it was about 15,000 naira to 25,000 naira per unit. So you can see that even then, even though people have to cough up hard-earned money, it still does not equate to the economic cost of that blood unit.
Exactly.
But there is a lot of untapped potential around the collaborations that can help to drive down substantially this cost of blood to patients, their families, and the communities. And so that's what I would like to end this note on. So for organizations, either non-profit, NGO, private, organized private sector, these are some of the collaborations that can help, because for as long as individuals feel that they are shortchanged, they donate blood freely, but when it's needed, there is some cost incurred. It erodes that trust balance that will help us build a sufficient blood donor base. And so for organizations that are looking towards how to help, safeguard lives, improve health and well-being, these are some of the things that can be considered. Collaborations to support in the processing and storage of blood that can help drive down the economic costs to individuals and their families.
Thank you so much for a beautiful conclusion, Dr. Adaeze Oreh. Global citizens, you've heard from our honorable commissioner, even though she's here today she's very many quotes today on our platform, public health expert, physician, former head of research, National Blood Transfusion Service. Please read our paper. The paper actually, it was published less than a month ago. So if you're interested in blood donation discussions, whether you're not even interested, so because anybody might need blood around you. You yourself might need blood tomorrow. Please read the paper, share with your colleagues, discuss with your colleagues, and most importantly, use it for yourself, because that's what we are about implementing, not just reading, but discussing and using the education for yourself. Have a blessed week.